Hey guys, welcome to our Facebook Live with the admissions team here at GPH. I'm your host, Deborah Nakumaya. On today's show, we're going to be talking with our admissions team and some students here at GPH. We're going to be talking about the Masters of Public Health program here at GPH. I'm joined by Zachary Judy, who's our admissions officer. I'm with Giovanni Apollon. He's a second year EPI student, and Ekamini Isaiah, who's a second year health policy student here. Thank you guys so much for coming on our show today. It's awesome to have you. For our viewers out there, please tell us where you are and drop a comment with questions for our awesome guests here. So let's dive right in. So tell us just a little bit about the programs here at GPH.
Sure. So there's a couple different types of MPH programs. We have our on-campus MPH program, which you guys are both students in. We also have our online SDG program, and then our cross-continental MPH program, which is a different experience. It's a one-year program that's taught mostly abroad. But for our on-campus program, it's a 2-year program right here on campus on the Washington Square Park in New York. And there's 8 different concentration areas within that. So everything from epidemiology to global health, public health and nutrition, environmental health, really does a good job of covering, I think, the field of public health generally. And within that 2 years, you start off with your core fundamental public health courses, you move into the courses specific to your concentration, and then you get the opportunity to take some elective courses at the end, which sort of allow you to specialize a little bit more.
Awesome. And how can prospective people that are interested in these programs, the on-campus versus the cross-continental, how can they apply? And are there any important deadlines that they might need to know about?
Sure, of course. So the applications for both programs, it's through the SOFIS Common Application for Schools and Programs of Public Health. And we're still accepting applications for the cross-continental program now on a rolling basis. So there's still space available, so get your applications in as quickly as you can so we can get that review process started. That's a program that starts in June, so you want to get your application in earlier so we get you decisions so you have time to make your plans for that. And then for the on-campus program, that deadline is going to be February 1st, and so that's the deadline to actually submit the application itself. But we know there's certain application documents that applicants might be waiting on, GRE scores, sometimes letters of recommendation, sometimes waiting for their final transcripts to be verified, and that's fine. Just make sure that the application itself is submitted by February 1st, and you're all set.
Okay, so even if they don't have those materials, they can get extra...
That's right, yeah. You can submit the application by the deadline, and you have plenty of time to submit those additional documents later. And for anyone who has questions about the differences between these two programs or has any concerns about meeting the deadlines, just contact our office. We're happy to help work with you on that.
Awesome, thank you, and we'll definitely share, contacts as at the end of this session. So we're going to turn our attention to our awesome students here, Giovanni and Ekamini. So, do any of you just tell us a little bit about, your NYU experience thus far?
So far, NYU has been a really great experience for me, especially being a part-time student or working full-time. They've really allowed me to able to balance everything. Most of our classes start around 4:55, so you still have some time to do things during the day, and it makes it a little bit easier for time management for me.
That's awesome. How about for you?
So I'm a little bit opposite of Gio. I'm a full-time student, but I work part-time, and I think I can say the same thing. Having that dual partnership, it allows me to gain a very deep experience in terms of academics, figure out what specifically I'm interested in health policy, but then also to practice it through part-time research with professors and other coursework as well.
That's amazing. And honestly, can you just go back to the time, when you got that admission letter, to NYU? What was that experience like for you guys?
I can honestly say that I was away in Spain on vacation when it happened, and when I looked at my email, I screamed a little bit because I'm born and raised here in New York. I lived here my whole life, and I wanted to stay here in New York. So from the moment that I read that I got accepted to NYU, like I didn't even see anything else from the letter. All I saw was congratulations, and
You just closed out.
yeah, it was a great feeling for me.
I can only imagine. How about for you?
Similar to Gio, we are both from Long Island, so we know the name of NYU. We know the resources that are available with NYU, the huge campus, the huge platform that it has here in New York City. So to be accepted to NYU, we just knew the large opportunities that would be ahead of us, and it was just there for the taking for us.
And I mean, I think you touched a little bit, on, resources that, the college provides. If you want to talk a little bit about, how would an MPH program here, like what resources should prospective students be expecting, to get out of this, MPH experience?
Sure. I think there are a couple advantages to doing the MPH program here at NYU, and some of the things you touched on, like opportunities, access to internships. Being here in New York, I think, is one of our major strengths. This city has such a concentration of organizations and opportunities for students to get involved in, to actually be, getting that practical experience to go along with what they're learning in the classroom. Then on the same token, the opportunity to engage with faculty in research. We have a number of faculty-led research labs that give students the opportunity, starting as early as their first semester, to engage with them on real research projects, working on real programs that are tackling real problems in public health. And so that's another opportunity to take what they're learning in the classroom and gain some, put into practical use. So there's those, and I think another major advantage of NYU, and one of the resources that you can get here that I think it's tougher to see at other schools, is NYU's global scope, really. So we have these global sites all over the world, the full campus in Abu Dhabi, the full campus in Shanghai, and students can take advantage of these as part of the program. So, some faculty are doing the research abroad. We offer study abroad courses. I mentioned earlier that we have the cross-continental MPH program, which really gives students an opportunity to spend a substantial amount of time abroad. But now students can do short-term study abroad courses. They can do full semester study away courses now. And so for anyone who's interested in getting that sort of global experience, I think that NYU really has a lot of resources for that.
And just to touch a little bit, about for prospective students that might be more interested in the cross-continental, what does that look like? Are they just abroad for 1 year, or like how does that program work?
Sure. So it's still a 46 credit MPH degree, so you're still earning the same degree that you'd be earning here on campus, but you're earning it in a different environment. So you do one semester at the campus in DC, and then a semester at NYU's global site in Accra, Ghana, and then they finish up the program at NYU's site in Florence, Italy. And so, in each place you're getting the opportunity to take advantage of some of the organizations that are there, some of, doing internships with, local hospital systems in Ghana, for example, getting to engage with some of the faculty research that's being done in Florence on topics like, migrant and refugee health. So I think that it's a really exciting opportunity and a way to get a lot of real hands-on global health experience in a short period of time, because it's only 1 year, that I think especially sets students up for success and for applying for jobs in the global health sphere when they graduate.
I think that's really important. I mean, you touched a lot on, resources, research, internships. Have you guys had any of those experiences, with research or being involved in labs or anything like that?
So yes, I actually had a couple of experience. Academy and I, we both met when we studied in London for our J-term classes. And what was great about being a full-time worker, I was still able to take advantage of the opportunity that was available. Also, I am part of a lab here, the Tobacco Research Lab, where I am doing study on using the PATH study to look at doing research on electronic cigarettes and looking how they can lead to respiratory diseases. So there is a lot of opportunities even for part-time and full-time students, which was amazing that I was able to be part of.
Yeah, how about for you?
I mean, you touched on the resources that are available to us, and I feel like in this program, one of the biggest resources we have are professors who have connections both in New York City and internationally. So my professor, I really like to focus on international health policy. So my professor really provides me the opportunity to do research with him alongside, but was also the connect that I had to get my internship, which I did in London. So to have the opportunity to study in J-term and meet Gio in London, where you're staying in King's Cross, you're doing your coursework in Bedford Square, so you really are central London, and then to be able to come back, complete my spring coursework, and then go back again to do research was really like the best opportunity that I had. That really was a culmination, or was attributed to the resources here in the program.
And you know, you guys are saying, "Oh, I got this. I got." How were you guys able to, you know, leverage your past experience to getting these opportunities? Like, what are you guys doing? Like, like what to do instructions. If you can tell our audience, how are you guys getting these great opportunities? Because I'm sure, you know, we have all these opportunities, but access is also important. How are you guys accessing these opportunities? What are you guys doing?
I think because we are MPH ambassadors, and a big question that people have is, should we go directly from undergrad or not? So I am coming straight from undergrad, and Gio has had some work experience and since undergrad, and both have their pros and cons, and I think it's a different approach to how you have to come into the MPH program. So me not having that much work experience other than the research that I did at undergrad, it really is a little bit more on myself to look into these, talk to Osterman and look into jobs, having my professors look over my resume and CV, constantly communicating what my research interests are so that I can find the right door, and maybe a little bit longer of a path to do so, but I think that here at NYU with all the resources available, it is doable, and once you make that first step, the future steps are a lot easier to do.
Yeah, I completely agree with Academy. I was out of school for about 3 years before I decided to apply for an MPH, and working for 3 years, I'm a respiratory therapist. I realized that one of the main focus that I want to do is stay on respiratory diseases. So just having that background and knowing exactly what I want to do actually helped for me. But then again, being off from school for 3 years, I had to get back into
the
studying,
student,
the student mode and everything.
Yeah.
Like just had to like work on my time management, and once I got that down, it was just a matter of what day I do what.
Awesome.
Yeah.
And I mean, she mentioned a little bit about Wasserman. What is that for our?
Sure. The Wasserman Center for Career Development is the career center for the whole university. So NYU has this astounding career center that they do programming specific for the different schools, including the School of Public Health. So we started off the year this year with Career Week. And we had speakers from Wasserman each day coming and talking about, like, here's how you navigate, you know, the field of public health jobs, and this is how you search for internships specifically in the field of public health. So they make it very focused, I think, which is, you know, especially helpful. You know, down to things like, this is how you look for jobs specifically to nonprofit organizations. You know, how is that different? Because I think for a lot of students, you know, especially those who are coming directly from their undergraduate program who haven't had to go through that same sort of job search before, it really helps them, or are just overwhelmed by, like, what does it mean to look for a job or internship in New York City, which I'm sure, you know, can be overwhelming. They're there to help sort of bridge that gap. Did you just, you know, use Wasserman much for applying for positions?
So I definitely used Wasserman's resource for, I made an appointment so they can look over my resume, so I can apply for research lab. Because one of the things as our concentration epidemiology, we need to have experience to go into our thesis class and do a little bit of research before we can start on our thesis. So Wasserman, they looked at my resume and they broke it down and helped me rebuild it to make sure that I can get into these opportunities that I want. And it looks better than ever.
Yeah, Wasserman was definitely one of the tools that I used when I was initially looking towards internships in terms of resume building, knowing and utilizing websites that I could look to kind of broaden my search. But I know one cohort of our year that really has used Wasserman, especially now in the job hunt, are the international students who kind of have this question of what lies for them after they graduate from the program. And Wasserman, along with our college, has just been really good for them to kind of navigate that whole process for them.
I will also say Wasserman, I think recently we had a career fair where a bunch of organizations, profit, nonprofit, came in and told us about what internships that they had, what job opportunities will be like after second year, what you're looking for. And I went through that too, just to see exactly where, if I wanted to continue off to my PhD first, or do I want to work again first, and see how things like that goes along. So Wasserman was really good for that.
And to our audience members, you guys can drop questions if you have for Ekamini, Giovanni, or Zach over here. Please drop your questions. I think moving forward, I want to ask just a little bit about what do you look for in an ideal prospective student at NYU?
That's a question I get a lot from prospective students. And you know, the answer to that is there isn't really one specific thing. There isn't really there's no such thing as an ideal candidate. I mean, people will come into the program and make really good students here at NYU for different reasons. In some cases, it's because you know they had this experience as an undergrad. Maybe they had studied public health or something adjacent to it, and they know that this is what they want to do. And so they come in directly from having finished their bachelor's degree. And in other cases, it may be that their path to public health is a little bit longer. They graduated, they were working in some other field, they got some experience, and then maybe through that experience came to realize like, oh, actually what I really love, what I'm really passionate about is, you know, affecting like health on sort of a, you know, a population level, community level. And so then they come to the program through that. So there isn't really sort of a right or wrong answer. People come with all different sorts of undergraduate majors, having studied all different kinds of things, and that's totally fine too, because you know the field of public health, one of the strengths of it is that it's so big. I mean, it's so broad, and encompasses so many different other disciplines, and so you can bring us all different kinds of skill sets into that, and you know, make a difference.
I think that's important, and I like that Zach talked about, you know, how varied public health is. How did you guys choose your concentrations? You're in epi, you're in health. How did you guys narrow it down? Like, I'm gonna study epi, you know, or I'm gonna study health policy.
It's a journey, I think.
Tell us about the journey.
I don't even think you know, but I was originally social behavioral, and I eventually switched into health policy. And I really think the core courses that we all take our first semester are important, and they're there for a reason, and that's really where you should do some soul searching, because public health is so interdisciplinary. We're taking our core courses, and that's the time where I really said, where you have the time to say, is this a concentration that I want to be in? You're taking that core course and you're exposed to other cores, and you can see how they are parallel to one another, or you can ask yourself, hey, I thought I was into this, I'm really into this, and this is a great time to explore that as well. But once I settled on health policy, after that, like I said before, it's really meeting with professors and kind of listening to their research, kind of giving them your spiel on their interests and balancing their work experience, their research experience to kind of help them intertwine your journey. So from taking core courses in the beginning to then taking concentration-specific courses in the spring, then applying your internship, you really kind of build the layers and saying, okay, this is what I'm interested in, and then you're ready to graduate.
And how about for you? Why epi?
So it was a difficult decision for me at first. Before I started applying for my MPH degrees, I wanted to know I knew I wanted my MPH, but I wanted to know what outlook for jobs that I want to do when I'm done. My long-term goal is I do want to get my PhD, and I do want to go for research. I'm more of a data person. I like doing research, gathering the data, looking at the data myself to see what interventions I can make from the data that I'm looking at, because I know everything about it and the nicks and cracks. So EPI just seemed like the perfect choice for me, for someone who's data-driven, and biostats was a little bit away from what I wanted to do. Instead of just data, I wanted to focus my data and use it towards respiratory diseases. And I felt EPI would give me everything that I need to utilize what I want for my goal.
That's awesome. And I mean, you know, you guys have spent 1 year at NYU, which is awesome. What would you say has been the best part, you know, of your NYU experience this far? Because we're all graduating in the spring, you know. Looking back at is it a year and a half or a year? I don't know. Like, what's been the best part of it?
Well, I do have an extra year because I'm a part-time student. I will graduate a year, not this spring, next spring.
Yeah.
The best part of it, I can say, is that NYU has just been great with my schedule. Being able to participate in a research lab, go to class, and go to work, Sounds like it's like a lot and can be very stressful, but at the same time, luckily my PI understands that I work a full-time job, and as long as I email him my results from my data, he's completely fine with it. My classes, my professors are just amazing. They're like the perfect resource for everything I want to do, and even when I tell them what I'm interested in, even though if they're not interested in my same interest, they point me in the right direction, who I should talk to help me get through what I need to do. I feel like, and the times of the classes just work so much in favor for me. Everything about it has just been great for being a part-time student, and being able to participate in and studying abroad in London. That's something that I never thought that I would be able to do. It was one of my biggest regrets for undergrad, was not being able to study abroad. And the fact that I was able to go for 2 weeks, go to London, explore a little bit, and have these people from different lecturers that's telling us about their health system was just amazing.
Yeah. How about for you?
I think there's two parts to my best part of NYU. First, it's the people, the friendships that I've been able to make, the connections I've been able to make. We're all studying the same umbrella theme of public health, but we're all interested in it in different aspects, from EPI and global health to EPI and respiratory health to international health policy. So to some, they hear one, they're like, I'm not really interested in that. But to be able to sit down in like our student space, 726 Broadway, and see us all come together after we've kind of gone into our separate concentrations, it's kind of that great feel because you're with your cohort. I think the next part, for the best part of my experience at NYU, has just been seeing my journey pieced together. When you come in straight from undergrad, there's a sense of uncertainty because you are surrounded sometimes with people that have been in the job market for 5 or 6 years. You have professors that have been doing this for a certain time, and it can be a little bit intimidating. But to kind of come in and then see everything pieced together, and you're kind of really going into the right direction, and maybe the plans you had before aren't the same plans you have now, but you're working towards those goals, and you're working with professors, and you have the connections I've made from professors, either directly or connecting me to someone else, has really been beneficial. So seeing my whole journey come together has been one of my best experiences.
And you guys keep talking about the study abroad. You guys want to tell us, more about the study abroad? What was that like? Application process to the time being there, to looking back at, what you gained from that experience.
So we did what's called J-term, which is essentially you take a course for maybe 10 to 15 days in one of NYU's international sites, or also in the New York City location as well. What's great about the J-term is that it applies to your spring schedule. So for some students, it's a way to take a lighter course load in the spring. We went to the London site in Bedford Square. We took a course on non-communicable diseases with Professor Bowden Albala. It was a great opportunity for us to kind of balance seeing London for the first time and also being in class and kind of using the networking opportunities every day while we were in class as well. I forgot, I think you went to
I went to Florence.
Florence.
Yes, I did.
You can answer this question as well.
I mean, I think, the interviewer becomes the interviewee. I personally, so we went to Florence and we were studying migrant health in the Mediterranean, which is very poignant even in this moment with the refugee crisis and, what's going on in Libya. It was a very interesting course. We studied it with Dr. Nate Bertelstein on the NYU Florence campus. And I think that was more of the, highlights of my experience as well, because, we were able to not just sit in a classroom somewhere internationally, but actually go into the field and interact with people that were going through that had crossed over. A lot of West African migrants, a lot of Syrian migrants that were in Italy. It really brought it home, if you know what I mean. Because we're here in New York in this wonderful place with lights on, learning about these things through PowerPoints, and then being able to remove yourself from this place and go actually into the field. I think it really brought it all together for me. But yeah, so that's my little spiel about my study abroad experience. But I would definitely recommend it, that because you have the 1 year J term and then the other year. I would really recommend it for any prospective student, out there, So, but I would say, why did you guys choose NYU? Why NYU? There's so many other schools out there. Why NYU?
Well, one thing, I was born and raised here in New York. New York has been my hometown. I love New York since the day I was born. I knew I wanted to stay in New York. I like that NYU is not a traditional campus. I like that it's open. It's kind of you're within the city. There's buildings all around the city, so you're on campus, but you're not on campus, if that makes sense. I like the opportunities that comes with NYU. I like that it has so many global sites. There's NYU London, NYU Florence, NYU Dublin, NYU Abu Dhabi. The list goes on and on. I just love that the connections that you can make with NYU and all the resource that comes with it. Yeah.
You have anything to add?
I think one thing I can add is the flexibility it's
Yes.
allowed us as well. I really needed to stay home and be a support system after I came back from undergrad. So to have that opportunity and still remain full-time has really been a blessing for me. But I think also for you, trying to work full-time and also go to class part-time, the flexibility that the program allows for has really been beneficial for us in this journey as well.
And to turn over to Zach, I asked them, why NYU? Why is GPH, unique? What sets GPH, the College of Global Public Health, apart from, other, MPH programs?
Sure. I think part of it is that we are the College of Global Public Health. And so while there are certainly students who come into the program and they know that they want to focus on, public health issues, domestic ones right here in the U.S., we have this opportunity to send students abroad to London, to Florence, to put you sort of there on the ground doing that. That is unique. It really is. Programs like that cross-continental MPH program is a truly unique program. I don't think there's any other program like that at another school of public health. So NYU is constantly trying to do things differently. Like we're trying new types of courses. We're connecting students with. You didn't talk about like our partnership courses. I'm not sure if any of you guys took any of those, but there are these classes where we're putting our students in the classroom with professionals from the World Food Program or from UNICEF, and they're learning, they're taking this class together, but they're learning from these people that do this every day. And those are another amazing opportunity to sort of, bridge the academic piece that you're getting in the classroom with actually doing this as a career, right? And so I think that those types of opportunities, I think, they abound here at NYU. And that's sort of what this program is sort of designed to do, is to give you those types of experiences.
Yeah, and I think for me, what I really love about NYU is how international it is. It does, I know we're all sitting here talking about it, but it really does, it is truly international. You are truly able to connect, with the global space in public health, at NYU, which you might not necessarily get, at other schools. And I think that's why I really like NYU. It's amazing. And, now we're beginning to wind down a little bit. What classes have you guys taken that have just been like out of this world, if I could say that,
There's just so many.
There are just so many awesome classes, right?
Well, one class that I haven't taken yet, but I'm very
Excited.
interested and excited to take is because I'm such a data person. There's a class that is being offered by Dr. Goldman, the data for SAS. Which is a different, so there are different statistical programs that we can use to get our data and how we do our research. One of the main ones that we learned here is Stata, a little bit SPSS too, but depending on where you want to go for work, sometimes they use one data source over another. So I'm really excited about taking the one for SAS because I do want to open up my horizon and be exposed to different statistical software where I can be really well-rounded. Yeah.
Yeah. How about for you?
I think one of my favorite courses was comparative health systems. It provided me the opportunity to kind of take the policy knowledge that I've gained in my first semester and partially my second semester as well, and really critically analyze international health policy, which when you say it sounds easy, but then you actually sit down and you realize it's not that easy to actually do it. And it's probably one of the most frustrating and challenging courses that I've had, because you have the professor that sits down with you and says, send it, do it again, do it again, do it again. But coming out of it, it was one of the best opportunities that I had, and I think I've used it in every other setting as well. But I think another great thing about NYU is that you have the opportunity to take your electives anywhere across NYU, whether you want to, because public health is so interdisciplinary. I think the college is also creating the avenues for you to also take courses in other colleges that you think could supplement your education, whether it's the business school, the law school, the school of public policy. It really is interdisciplinary, and it allows you to shape your MPH the way you want to, with the support of the department.
I would like to add to, for the class that me and Academy took for the study of non-chronic diseases, one of the things that we learned, which was really great, was how to write a grant. We were broken up into groups, and for someone who wants to go into research, grant writing is very, very important. I thought that was a really amazing experience, and our professor was actually, she looked at our grant, she broke it down.
Start again.
Yeah.
I remember.
Then she broke it down some more.
Yeah.
Then we present and broke it down some more.
Yeah.
Yeah.
And then at the end of the class, we were able to at least have the building blocks and the tools that we need to learn how to start our grant writing process and to like dive into it.
Yeah.
Mm-hmm.
Yeah. And I think and you got that, from that one class. Even here at NYU, there is a grant writing course that I took it, and it was really good. I think it's an essential skill for, all students in public health, because the way funding is shifting, in the present climate we're in, I think it's a very important skill to have. And, we have that here at NYU. And there's a saying that says, all work and no play makes Jack a dull boy. So here, we've talked a lot about, work, research, labs. What are the social activities that have happened at GPH? Because I know you're part of the Student Government Council. So if you want to give it a shout out here,
Yeah. So I'm the graduate events officer actually for the Student Governing Council, and what we do is we try to hold networking. And also social activities for the graduate students. I have an undergraduate counterpart as well. So we try to have mixers for our graduate students with ourselves, and also we're having one with other colleges outside of CGPH that have kind of a public health focus. We try to do networking opportunities. We try to do panels with other professors. So we oversee a lot of other clubs as well, health and human rights, healthcare consulting organizations. So just to foster the opportunity for us to network and also interact as graduate students ourselves in New York City are some of the things that we do as Student Governing Council.
Speaking of networking, can prospective students, are there any opportunities for prospective students to come, actually physically on campus to check out, a lot of what we've talked about today?
Yeah, absolutely. So in addition to having our student ambassadors' contact info up on the website, so if you'd like to reach out to them, you can. But if you're actually going to be here in New York visiting, you can contact our office. We can help you to schedule a campus tour. So you can actually get to see, and they have campus tours every Monday and Friday, specifically for prospective graduate students. So get an idea of what it would be like, what parts of the campus would you really be, taking part in as a graduate student. But also absolutely schedule time to come meet with us one-on-one. We'll help you, we'll sit down and talk to you about the application process, about the programs. And if you'd like to sit in on a class, we can help to organize class visits as well. I think that's helpful to actually see what is it like being in the classroom, watching, the students interact with the faculty to get a better idea of, what that experience would be like for you as a student. So yeah, come visit us, really.
Yeah, and now we're about to wind down and close out this interview. What would be just one piece of advice that you would have for prospective students?
One advice, what I did while I was applying for NYU is I came to an open house. I took a tour of the school, and that I really liked that. I did that with a bunch of my schools that I was looking into, and that's how that was one of the ways I was able to like solidify what I want. I would say just visit your schools, make sure that they have what you're looking for. Ask questions on the tours. It's better to see it live and see how it's going versus research that everything behind the computer versus seeing it right then and there. It's two different experiences.
Yeah. I think I would echo what Gio said about constantly asking questions. I mean, you're going to be spending the next 2 years at wherever, or one, depending on where you want to go. So really ask those important questions that you feel that you need, and feel free to contact the ambassadors, contact the admissions committee with those questions that you have, but also try to be as transparent as possible. Do the soul searching that you want or that you need to do, whether it's in deciding if you want to go part-time or full-time, whether it's your concentration that you want to do, and really let that follow through to your questions as well, but also be transparent to whoever you're working with, and constantly communicate what your interests are, because you never know who you're going to speak to that could help you move on to that next stage of your career.
And then to close out, this conversation, if prospective students have further questions, about all that we've talked about today, how to apply, how can they contact you, where should they go, what info do you have for them?
Sure. So any questions that you have, you can email us. It's gph.admissions@nyu.edu for global public health. And then I mentioned before, there's that form on the website. You can schedule a visit to come in and talk to us. Our phone number is also on there as well, so if you want to call. And actually now on our admissions pages, there's a little box that'll pop up and you can chat with us live. So if you have a quick question that you don't want to actually send an email for, you can actually just chat the question at us, and we can respond to you live that way. So lots of ways to get in touch. And yeah, just keep in mind that the deadline to apply is going to be February 1st through the SOPHIS application.
Thank you so much, guys, for coming on our show. It was amazing to have you on.
Thank you.
For having us.
Yeah, thank you.
Yeah.